Go to the last part of the Carelogic training as it pertains to therapists. If you're hearing dinging in the background, that's my email. So sorry about that. Um, so I'm Annie Lane, therapist in Ohio East 1, Portsmouth, Ohio, and clinical lead for state of Ohio. Working on this project, which is the Carelogic training as it pertains to therapists. So we have gone over all of the things scheduling, like login scheduling, progress notes, location of documents, ISPs or treatment plans, both initial and reviews, and discharges. So the last part here is just a couple of different items to help you guys out along the way. That most of this, if not all, we're going to be talking about in the live orientation. But if you're watching this and you have not had live orientation yet, it will be covered. If you've already had it, that's good too. So you'll know what, maybe more clear what I'm talking about. So each thing is kind of meant to supplement the other, or these trainings can be watched, standalone. So what we're going to talk about on this very last portion of Carelogic training is we're going to talk about consents, where to find them, when to do them, who does them. I talked a little bit about in the not so distant past, therapists were completing all of the initial consents at the time of intake, be that a telehealth intake or an in-person. Recently, that was switched over to the office managers completing the initial consents with the client, be that a phone call with the client prior to their intake. If it's a telehealth intake, we're asking them to come in 15, 20, 25 minutes earlier to their intake appointment if it's in person. So the office manager will complete the initial consent. In the event that they are not able to, we're definitely going to do that. And all the consents are due every year. So annually, they must be completed too. So even if we aren't doing them at intake, we definitely need to know where they are and kind of how to get those done because we're going to be doing the annual ones. I'd mentioned earlier that staff members can do consents besides therapists. It can be the office manager. It can be a case manager. I've had situations where a case manager with a client, I see that their annual consents are coming due, and I know the case manager is most likely going to see that client before me in certain situations. So I have them complete those. Those can be uploaded to their chart, which leads me into, we're going to talk about the document library, and we're going to touch on consents versus ROIs. However, I do cover that in the live orientation with therapists also. We're going to look quickly at searching and printing your caseload. And lastly, but not least important, is failed activities, which sounds a lot scarier than what it actually is. So we will get there. So first, Carelogic screen share here. We're going to look at consent. So I keep using this QSI test person. So we're going to keep on using them. So we can click on their chart. You can click on them to get into the chart, or we can search them up here. Click on ACR to get in. Just like most of the other documents that we use, if not all, you're going to be found, the consents are going to be found under my caseload. Real easy to find. It's the very last tab down here, path consents. And here they are. Got the AOB patient responsibility. We're going to skip over authorization to ACHI and talk about that in a minute. HIPAA acknowledgement, notice of privacy practices, intake checklist, client's rights and grievance procedure. You will find PDF copies of all of these in the therapist orientation module training folder that you all will receive access to at the end of your orientation with me. Really important, we have the consent for treatment, e-scribe consent, telehealth consent, and client summary of client financial responsibility. School excuses are here. They are not required. Obviously, that doesn't pertain to every client. Telehealth consent, not every client prefers telehealth. Let's say that we are doing these consents at intake. Maybe the office manager was not able to do them because they weren't available. But if there's no telehealth consent that exists, we definitely want to do one, even if the client says, I don't want telehealth, because you never know when something may happen and they may want to utilize that option. I'm going to use the consent for treatment as the demo on this because pretty much it's going to look the same. We'll do a couple of them, but it's going to look the same the way that they're set up, clicking submit and signing off. Then I'm going to tell you why this one is different than the other ones. So these consents, not this one, not the authorization to release PHI, because that's a release of information, or ROIs, I refer to it. We'll talk about this in a second a little bit more, but those have to be done in person. The remainder of the consents can be done at this time, at the time of this recording in Ohio, via telehealth at minimum, or in person. So let's go down here to consent for treatment. You won't have this many. I'm just demoing. So this is a test, or practice environment. So here we go. Upper right-hand corner, just like with most of the documents. The consents are good for a year, so I'm going to set this out for a year, just like I did with the ISP. Also, in the therapist training module that you all will have access to after you do training or orientation with me, again, there will be PDF versions of all these consents, and also you're definitely going to have access to what's called Consents Explained. It's part of that orientation folder. So if you have individual questions about each consent or need help explaining them to a client, that can be found there also. But since this training is Carelogic specific, we won't get into that at this time. You'll mark if the client is under age 14, yes or no. Once you get to the bottom of the form, you're going to hit submit. If the client is in person when you're doing the consent, you can have them walk around to your computer and sign the mouse pad. Some clients may be present but ask you to sign on their behalf. At minimum, if it's telehealth, we definitely want to sign on their behalf with their permission. Ignore. I've said this a couple times before. I'm left-handed using a mouse, right-handed. It is what it is. I always add in information just to cover verbal permission granted. Whichever way works that you can kind of document that information there. Doesn't have to look exactly that way. Most of these consents don't have to be sent on to your clinical supervisor for a second signature. So you can add your electronic signature, hit submit, and it will populate over here. You will see when the signature date is, and as long as you complete another round of these consents prior to 365 days, we're good to go. So you will do that at each one of these consents. Click on the consent, add it. Effective date, 1 year. Scroll down, add any pertinent information. I think I must have entered in something wrong here. Yep, quirky. It has to be done. Oh, I forgot to do 24, 2025, or it won't take it. So you'll see that happen just like it happened to me. I'm going through this pretty quickly. You're going to want to talk to your client about these consents, or if it's the office manager, they will do that. At the end of each page, hit submit. Add your signature, time purposes. And hit save after you enter in save, or submit after you enter in your electronic signature there. So you'll go through each one of those and complete them that way, and it will populate here. Now, with the one consent, it's not really a consent, it's actually a release of information. In the state of Ohio, a release of information must be completed in the client's presence. It can't be a verbal signature. To be honest, I usually use a paper form, and I have the office manager upload it to their document library within Carelogic, which we all have access to, which I'll show you here momentarily. So this is the one consent. Cannot be done via telehealth, needs to be done in person. So why do we do a release of information? Well, the client needs to maybe give you explicit permission to speak to another provider outside of PATH. Maybe it's another doctor, not with PATH. Maybe it is a pastor or minister. Maybe it's a family friend. Either which way, the client has to give explicit permission for us to speak to somebody else granted by that patient or client. So this needs to be done in person. If you're doing it in the Carelogic environment, they will need to walk around to the mouse pad and sign. So on the signature page, they would need to come on around to your mouse pad and sign off themselves. There. We talk about releases of information much more in depth in the live version of my training and orientation with new therapists. This Carelogic information is meant to supplement it. So moving on to document library. What is a document library? How do we have it? What I just referred to was I do paper releases of information. Again, you have access to the PDF forms in the therapist orientation folder that you'll get at the end of orientation. You'll get access to it, a link. And so I would take that paper release of information up to my office manager and ask them to upload it to the client's document library. You can find the document library by going to the client's face sheet. Again, you know that you're in their chart when their name, client number, and date of birth are at the top, as opposed to the billing schedule progress note environment. Clinical record, document library. Test, practice environment. So there's a couple here. So you would find anything that you've done on paper with the client and ask the office manager to upload to their document library would be available here. When we're doing the live training with me and we talk about the intake process, if the client has a custody agreement, for example, that information would be found here. And office managers, it is their responsibility to obtain that information prior to scheduling the intake. If there is a custody situation, those papers are going to be available in this area. That's the document library. Paper items that need to go in the client's chart. Maybe it's a court order. Anything paper that you need to go in the chart, paper consents, custody agreements, etc. So that's where you're going to find that. So just to recap there, get into the client's chart, click on their name or search up here. My caseload, clinical record, document library. And you can search. You can go back. It usually populates back several months, but that's where you'll find that information. Service inquiry. This is important too. Let's say you've had trouble getting in touch with a client. Maybe you're looking at the discharge process. Maybe they haven't shown for you. Again, you would follow the discharge process for these real detailed items step by step. But if I wanted to find out what's been going on with the client, or if there's other providers that may have contact with the client, maybe I'm having trouble getting a hold of the client, but maybe the case manager isn't. Well, let's check it out. We're going to get the client's chart. There's there, my caseload, inquiry, and service history. Again, get into the client chart by way of the schedule or searching, ECR, inquiry, service history. This will populate 3 months back. Sometimes what I do, and I've mentioned this on other portions of the training, if I want to see this client's entire service history, I know that the day that Carelogic rolled out was March 7th, 2022. So everything that's happened with their services, be it case management, intakes, it's not going to look like this because your clients should only have the one intake, but this is, again, a test environment. You can see what's going on here, whether it's billed, unbilled, which people have provided services. And this goes all the way back to the beginning. But when you go into the service inquiry or service history, inquiry, then service history, it will pre-populate for several months. You may want to look back further than that. This is how we do that there. A lot of times this relates to the discharge process. I look at this a lot of time when I'm looking at cases and who may need to be worked toward the discharge process, etc. I'll find this information here. Can't get hold of a client. Well, case management's seen them a couple times. I'm going to reach out to the case manager and say, hey, you've had luck getting in touch with this client. Can you help me out? Maybe that they do an annual ISP, because if it expires, they're not going to be able to receive case management, for example. So it would be great to have some teamwork with care team to help get the client. You're going to find their service history here. That's the function of service history. Maybe you and your clinical supervisor have discussed maybe transferring a client to another therapist. Maybe the client requested that. Maybe you're working on a discharge, you're not sure if it's gone through correctly. Well, you could search your own caseload for your active cases. I will not be able to search mine or any other provider's caseload and show it on this environment because of HIPAA. But what I can do is go to my caseload, my reports, active caseloads. It will populate a different tab. If you want to see your current caseload, you're going to put the current date, start and end. You will choose your name over here, and you will click on View Report. I'm not able to populate that here because of confidentiality. So the only other item that we really need to look at this time is going to be what's called failed activities. What are failed activities? Well, failed activities are pieces of documentation that you do that are unsigned or unfinished for the most part. You may also end up with a failed activity. They all must be resolved ASAP based on our note policy and all that. You're really going to need to figure out if you have failed activities. Most likely your clinical supervisor is going to let you know if you do and help you work through those. But it's good to figure out if you have any and be able to know how to have access to that so you're not kind of in the dark or blindsided. Most failed activities are because you haven't completed a notation on a client that you started. Or at intake, if you've got your CCA document and you put the diagnosis in when you saw the client on today, 1/25/24, and then maybe you do the note the next day, the intake note that gives you a chance to take credit for your work and get paid, and it's your record of having completed that CCA outside of the chart. There's a section on that note that we went over earlier that says diagnosis, and you're going to want to put that diagnosis in again. The date needs to be the same date as the date that you met with the client, even if you finish that documentation, for example, the next day. If the date differs, it will cause a failed activity. And if it's not resolved by you, for example, at intake with the diagnosis, if those dates don't match up and it becomes a failed activity, it will also cause failed activities to occur for all subsequent documentation, not just yours, but any other line of service or provider that's providing services and doing the progress note, be that MedSom, prescriber, nurse, case manager. So you really got to be cognizant of those types of failed activities. But for the most part, it's going to be documentation that hasn't been signed, not completed, that was started. So here's where you find that information for yourself. You've logged in your schedule, back up to my caseload, my reports, failed activities. You can search them on this page. I always make sure the all button is clicked. You can search it by client, search it by provider, which is you, and that will populate information. I'm not going to search my own. I have one note that is waiting to be signed by my independent licensure supervisor. And so it's showing as failed, but it is the client's information, so I can't show that, but this is how you get there. Another way to look at your failed activities is to go into the alerts tab and go down to failed activities. So that's how that works from that tab. The only other thing I believe, I think that's going to basically cover it. Failed activities, consents, release of information, document library, printing your caseload. I think that that pretty much concludes everything for today on all things that therapists need to know. Again, you're going to most likely, if you're viewing this before orientation with me that's live, we will talk about these things again, but at least this gives you an exposure to what it looks like in Carelogic if you've never used it before. Maybe you've used it with another organization and it looks a little different, because that's possible too. But hopefully this helps as a reference both now and to refer back to if you have questions. And of course, you can ask your clinical supervisor, regional leadership. We are here to support you. So if you've made it this far in training, this basically concludes it. There may be more to come at a later time, but thank you for your time and good luck and welcome to PATH. We love having you, and thank you for watching.